What's going on, fam? And welcome back. Thanks so much for joining me again. Today, I want to talk about what to expect at your very first therapy session. If you've never been to therapy before, you may have heard a lot of things about what therapists do and how they talk and how they may present themselves. If you go by a lot of TV depictions, therapists can go anywhere from being very cold and clinical to being like super kooky. But I thought it would be a nice little introduction as to what to expect in your very first therapy session. And I believe I've had enough experience that I can probably give some insight as to how your first session may go. I'm going mostly by my experience, a little bit by research and training, but putting all of that together, I've determined that there are about 5 components to an initial therapy session or an intake session. So in the first few sessions, the therapist is essentially assessing you. They're basically determining what the diagnosis is, if any, and what the proper course of treatment will be. They will conduct what's called an interview, a diagnostic interview, an intake interview. There's different names for which is basically the same process. We're gathering as much information as we can about the person so that we know the best way to treat them and minimize any risk of harm through the therapeutic process. That's important because different people need different things based on their issue. For example, a person with OCD is not going to do well with talk therapy. You're dealing with obsessions. So if you introduce a talk therapy program to a person with OCD, you're literally giving them license to ruminate on their obsessions, and that's not what you are trying to do. If you have a person who has depression, however, talk therapy would be appropriate for them because you need to help them learn how to assess their own thoughts and manage them in a way that would benefit them and not sink further into their depression. So the first part of that process is the referral question. So the referral question literally is, why are you here? What brought you to therapy? What made you reach out? Most people who reach out, I find, have a pretty good idea of what's going on with them. Most of them can tell me pretty clearly, I have anxiety, or I have depression, or my kid has ADHD, we have a diagnosis. I have a few people who have OCD and bipolar disorder. So most people who come to me pretty much know what's going on, but some don't. Some kind of come and they're like, well, I'm not really sure what to talk about. And sometimes they're embarrassed about that fact. So if you think you need therapy, you think you need help, do not hesitate because you're not sure and you can't pinpoint exactly what's going on with you, because that's not really a turnoff. So the people who do come in and they're not quite sure of what they need out of the process or what they're looking for, that's when we move into the background history. So the background is what it sounds like. What's your background? What's your family like? Where do you live? Where do you work? What kind of job do you do? How stressful do you find it to be? What are your interests? What are your hobbies? What's your social life like? Do you have a lot of friends? Do you have a little bit of friends? Are you in a romantic relationship? Do you have kids? So usually once a person starts talking about that stuff, that's just a sit back and listen kind of thing, and I'm just kind of taking note of this person's makeup. The next part is the medical history, and that, again, we can ask about that. Sometimes it just comes up as the person talks about their personal history or their social history. And so they'll volunteer the information. Well, I had an uncle who dealt with this, or my mother dealt with that, my father, so all of any medical history, whether it's physical, whether it's mental health and mental illness, if you've previously been hospitalized, previously medicated, we want to know all of that. If you've seen a therapist before and stopped, we want to know all of that. We consider all of that to be relevant information. Again, if you have family members who have similar issues to you that you've noticed. So I have a lot of people who have anxiety, and most of them can pinpoint at least 2 or 3 other members of their, if not the whole family, at least, 2 or 3 other members of their family who they know have had it or, have it, but maybe aren't diagnosed or whatever. But we find that a lot of behaviors and a lot of mental health concerns and illnesses do tend to travel in family. So it's important to know as much as the therapist would need to know to make sure that we have a complete profile. Then we would perform what's called a risk assessment. So the risk assessment, again, is pretty self-explanatory. We want to make sure that you are not in danger in any way. So you're not a danger to yourself, and you are not a danger to anyone else, and that no one else is a danger to you. So, we'll ask if you're in a relationship, is there any violence or abuse? We'll ask if you engage in any substance use or abuse. So alcohol, marijuana, any other, prescriptions. Again, we ask about medical history. So if that hasn't come up, then I just kind of will double check and make sure, are you on any medications? And I'll ask about allergies and stuff like that too, just to kind of let them know, it's not just about that. We're not going to call the police on you. We're not going to, even kids. I've had kids under 18 that, they smoke marijuana or whatever. That's not, they are still protected under confidentiality. So you telling your therapist that you do these things does not mean that you're going to get the police knocking at your door because the therapist said that you're in possession of whatever. Finally, what I tend to do after all of that comes out, after all of that is talked about, then I like to give a little bit of my background information, just kind of letting them know where I'm coming from as their therapist. I give them a little bit of information about my experience. And when I think about it, I am pretty experienced. We don't always think about ourselves. Honestly, sometimes I still feel like the 16-year-old girl in high school, and it just doesn't feel like much. But sometimes I'll look back and I'm like, no, you did a lot. So it's helpful to be reassuring to say that, no, I've worked in this type of setting. I've worked with this population and it's been this long. And so the therapist should be pretty forthcoming about their own background and where they come from as far as their education and training. And I am a therapist who does self-disclose. So I do put some personal touches in when I'm giving education on certain things. You might have a therapist that doesn't do that. That's okay. That's really the therapist's prerogative. But I do find that it does kind of help put people at ease that this happens to everybody, even your therapist. Finally, the final component that I'm making a part of the session is education and goals. A lot of the time by the first session or by the end of the first session, I have a pretty good idea of what the person may be dealing with, whether it's anxiety, whether it's trauma. And so I kind of start off giving a little bit of education on what those things are. I am a therapist who does like to give handouts and worksheets and homework. So I will kind of give them some things to read up on so that they have kind of a better understanding of what's going on with them mentally and physiologically. And then we talk a little bit about goals. We don't usually come up with therapeutic goals within the first session. That's usually stretched out over 2 or even 3 sessions, depending on the nature of the issue, the depth of the issue, exactly what the patient wants, whether they know what they want or don't know what they want. I always kind of let them know, the real work is going to begin probably about a month into therapy. Don't think you're gonna come see me and you're automatically, most of the time it feels good just to get it off your chest. So many of the people I've worked with end up crying like their first session just because they haven't been able to get it off their chest. And it's just something to be able to release whatever it is you've been holding on to. That in and of itself can be therapeutic. You're not going to magically change your life after 3 sessions. Give it at least 2 to 3 months before you even really look for significant changes. And again, depending on the complexity of the situation, for some people it might even take longer than that. Some people it takes sooner than that. I had one kid that I worked with, and I had maybe 3 sessions with them. I gave the parents some structure and tools on how they can manage their kids' situation, and they implemented it, and almost immediately things got better for them, and I haven't seen them since. So but that's pretty rare. That doesn't happen most of the time. I kind of give that education too, just kind of the expectation. Don't think it's going to be a instant change. Also, don't think that just because you make some progress that you're always going to be making progress. Life is not linear. Our growth and our healing is not linear. You might do really well, make some really great strides, and then you might have a setback. And I understand it can be very devastating to get a setback after you have, put in the work and you've implemented and you've seen the change, and then something happens and you kind of slide back a little bit. Most of my patients that have experienced that, they come back and they feel like super dejected, and I'm like, that's life. Not in like a minimizing way. Like, I understand how hurt that can feel, especially because you're also kind of off guard, because if you've been making growth and you're not expecting to have those setbacks, so when they come, it's kind of like caught off guard. You're not as prepared for it as you previously were, because you're moving into a new space in your mind and in your life. So but I give a little bit of encouragement, like, don't let that be the deciding factor of you stopping therapy. And it doesn't mean that you aren't growing. In fact, it means that you are growing if you're that upset by it. That's what I got. Hope it was helpful. This is kind of a companion video to the one that I made about how to start back with therapy after you've been hurt by your therapist. So I suggest, if you haven't seen that one, maybe go back and give that a peek, and then it should kind of put in together. So if you've never been to therapy before, or if you've been to therapy and you had a not good experience, or if you had a good experience but it's been a while and you're not really sure, then I would hope that this would be helpful to you. You don't have to have an agenda. You don't have to always have something to talk about. It's your therapy journey, so you essentially set the pace for how you want it to go. So I have patients who jump right in, and to be honest, those are the ones who tend to see results quicker, but that's not a guarantee. And then I see some that are a little bit, we're not ready to let some stuff go yet, and that's okay. And so we can compartmentalize. There's times when I'm kind of like, okay, you're clearly here for this, or I'm hearing their background information, and this is very clearly a big issue, and I see it as a really big issue, but it's not something that they want to deal with yet. I'm gonna go with what you're ready to deal with, and then slowly but surely I'm gonna work with you to try to come back. So hopefully that was helpful to you, and I'll see you next time. Thank you so much. Bye.